now going to run through some GMS3 temporary resident form scenarios with you. Okay, so we've got Bob. Now, Bob lives in Accrington up north, but he's currently on holiday down south in Devon. Unfortunately, while Bob has been on holiday, he's become unwell and he needs to see a GP. Now, he can see a GP temporarily while he's on holiday, as he's too far away from home to see his regular GP. Now, let's have a look what Brenda needs to do then. So, a patient who is away from home and temporarily resident at your practice for at least the next 24 hours and needs to see a doctor for medical advice, it can be treated as a temporary resident. Now, for the first 24 hours, a patient can be treated as immediate and necessary, and a temporary GMS3 form can be used, and that can be in place for up to 3 months. Now, the GMS3 form should be completed with the patient's administrative details, including the notes concerning their illness. Now, the form can be completed for patients who are offered telephone advice, immediate necessary treatment, for things like minor operations, vaccinations, and things like that. So I suppose just looking at what Brenda needs to really do then. So she'll just need to make sure that the form's completed in full. Now, to get the GMS3 form, that can be ordered through the supplies area in PCSE online. She'll need to include all the details of Bob's illness, including all his personal details. And she'll need to include telephone advice and minor operations and all those bits and pieces of any treatment that he's had. The more information that's included on there is the better. So once the form has been sent to Bob's registered GP, he knows exactly what kind of treatment that Bob's had while he's been away from home. Okay, so what does Brenda need to do then? So once the form has been completed, she'll need to send the GMS3 form to Bob's registered practice. In doing so, she'll need to scan both sides of the GMS3 form. Once she's scanned that through, she'll need to save that as a PDF document. And when she's saving that, we recommend that you do that with the patient's full name. So in this case, she'll need to put Bob's full name on there. Now, to send the form, she'll need to log into PCSE online and head over to the medical records area. And she can send that using the upload function that is available on PCSE online. All she needs to do is, once she's uploaded the form to her computer, save that to her computer, she can simply upload that electronically. That will then send that to PCSE, and then we will ensure that that is sent to Bob's registered practice. Now, if the practice don't have any scanning facilities, then within the same area where you will upload the GMS3 form, you can request a label to be sent to the practice, and then you would just add the GMS3 form in a polylock bag and send that with your City Sprint delivery. Okay, so just a quick summary then on GMS3 forms. So Bob could have a temporary treatment for up to 3 months. A GMS3 form needs to be completed after every visit. She would need to keep Bob's registered practice up to date by sending them his forms, and she'll need to send them as soon as possible so Bob's GP knows exactly what treatment he's had. The forms can be sent electronically via PCSE online. They are not sent through the clinical system. I know sometimes we get that query quite a bit, but they do need to be sent to PCSE so we can ensure that they are sent to the patient's registered practice. That's why we don't advise sending them via email, because things could potentially change. And it's a good idea to include a summary of the treatment so the GP knows exactly what treatment the patient's had. Now, I appreciate that was just a brief overview of medical record movements and GMS3 forms. We will be holding a webinar sometime in June for supplies and medical records. Now, we are just in the process of just arranging that, so we will be sending out details in due course with the invite and the sign-up link and things like that. So please do keep an eye out for that if that's something that you're going to be interested in.